you smiling.
I haven't smiled and shown my teeth in over 25 years. Whenever I smile, I'd smile like this because I was embarrassed. Now, I want to show the whole world.
The whole world smiles with you.
I've been practicing dentistry for 30 years. In all that time, in spite of various ups and downs in the economy, my cosmetic practice just keeps on growing. Why? I think cosmetic imaging has a lot to do with it. It's really great stuff, and it sets me apart from my competition. Cosmetic imaging simulates and it stimulates. It simulates the proposed smile enhancement, and it stimulates the patient to proceed with treatment. In certain cases, trial smiles can be more effective, but they are also more expensive in terms of lab costs and especially time. So even in those cases that I want to do a trial smile, I'll start with a cost-effective cosmetic image first. Quite simply, it shows our patients what we can do. This young woman came to me looking for a smile makeover. Her previous dentist recommended 10 or 20 veneers. We did a cosmetic image of whitening and just 4 veneers. When she saw the picture at her consultation, we started treatment that very day. And it's not just about the teeth, it's the gum line too. This is very important because any irregularities in the gum line must be addressed first. Otherwise, once the teeth are fixed, any gum issues really stand out, and the case then has to be redone. That can be a disaster. This gentleman needed to replace a lower front crown. He also wanted a great smile. He thought he just needed veneers, but these pictures convinced him he needed a gum lift first. These full face before and after pictures are very powerful. And if not now, it often plants the seed for future treatment. This sweet lady saw me for the first time 8 years ago. We did cosmetic imaging, including whitening and 4 front teeth. In this case, we gave her 2 options for the length of the 4 front teeth. And then I never saw her again, until she came back last year and we finally did the work. Her regular dentist wanted her to do the work with her, but when she was ready, she came back to me. Why? I think it was the cosmetic imaging. This young man already had 6 crowns that he knew needed to be redone. He knew that, and that's all he wanted me to do. But these 2 images, one with 6 new crowns, and the second one with a cosmetic gum lift and 10 teeth instead of 6, really made the decision easy. And as you can tell, he's glad he made the right decision. Cosmetic dentistry is not easy, but cosmetic imaging helps. Not just to envision the case, but to treatment plan as well. And now, with ZZ, cosmetic imaging is faster, better, and cheaper. It allows you, the dentist, or better yet, your assistant, to do a cosmetic makeover on virtually every patient that walks in the door. In fact, nowadays, they don't even need to walk in the door. All you need is a good quality digital camera, a smiling face, and you're good to go.
What do you do that's different?
Lots of things. But let's start at the beginning. It all starts with a photograph. And we take photos of everybody. And those full face pictures have got to be good. And just like everything else, the more you do, the better you get at it. And if you want to do more cosmetic dentistry, the best way to do more of it is to show your patients what you can do for them. But up until now, there wasn't an easy, fast, and practical way to do quality cosmetic imaging in your office. But now, thanks to ZZ, it's easy.
Do you sell cosmetic dentistry?
We never sell cosmetic dentistry. But cosmetic imaging does sell cosmetic dentistry. Because, if I have to sell it, I don't want to do it. I only want to do what the patient really wants. And whenever possible, less is best. We never push treatment. We try to treat every patient like we would treat ourselves. So everyone wants whiter teeth. So if just bleaching does the trick, that's what I recommend. It's always a good start anyway. And if I think direct bonding will make a patient happy, I'll do a composite mock-up. But if it's anything more involved, I always start with cosmetic imaging.
Do your patients really know how you can improve their lives with cosmetic dentistry?
That's a good question. I would have to say, most of the time, no. For one thing, most of the time when patients look at their teeth or their smile, they only see the top front six. That's because that's all they focus on when they look in a mirror. But there's more. The upper bicuspids show in the social or profile view, and the lower front teeth show more when you're talking. Also, as we age, we tend to show more of our lower teeth. And then there are the patients in denial. This is especially true with gum issues. They're so used to it, they don't always see it. And they usually don't even know we can help. Cosmetic gum procedures like gum grafts and gum lifts, they sound kind of scary. But once they see the gum line fixed, they can't wait to get it done. And that's important because the gums always have to be fixed first.
Do you spend a lot of time treatment planning with models?
Yes, of course I do. It's essential to treatment planning, but so are photos. But why even bother taking impressions unless the patient is interested? Cosmetic dentistry is always visual and usually elective. And that's why cosmetic imaging is so effective. Not just to help the patient visualize the results, but also to assess their interest before you go further, without risk of offending the patient or appearing pushy. A cosmetic image is the best way to get the show on the road.
How do you find out if they're interested?
I'll ask. And if I ask, that means I know I can help this person. And when I use cosmetic imaging, even if they aren't interested at first, they usually get interested, and get interested fast. Also, after all these years of doing cosmetic imaging, people now come to me specifically for cosmetic dentistry. Why? Because cosmetic imaging has always been an important part of my consultation. It helps both me and my patients. And maybe, most important, cosmetic imaging sets me apart from my competition.
How do you follow up on that consultation and cosmetic imaging?
A few days after we email their before and afters, we follow up with a phone call to make sure they got it. But most of the time, we don't have to. They contact us.
Do you find that cosmetic imaging better helps you understand your patient's expectations?
Absolutely. From the number of teeth involved, the color, the various combinations of shape and length, as well as the gum line. Cosmetic dentistry is all visual. You just can't get where you're going unless you know where you're going.
Are these cosmetic images of proposed before and after treatment helpful with your lab?
Absolutely. These cosmetic images give the case its soul. I want my ceramic artists, and they are artists, to know who they're working on and what we hope to achieve. Without these pictures, they're just models in a pan. Everyone works better when they can see who they're working for. And while we're on the subject, we're only as good as our lab. So, when you send your cosmetic cases to the lab, make it the best lab.
Thank you, Dr. B, and I'll see you later.
Well, thanks, Sam. I appreciate this time that we spent together, and I hope that all the dentists out there get something out of it. Thank you.